group did emptying and changing a colostomy appliance. Our group consists of Nikki, Karin, Jenny, Skylar, and Beth. During this teaching project, we surveyed nurses from Sacred Heart Nursing Home, and we asked them if they knew how to change a colostomy bag and what a healthy stoma looks like. Most of them stated that they do know how to change one, but about 50% of them said that they have actually changed one. A healthy stoma looks pink to red, and it should be moist. Now we're gonna change and apply a colostomy bag.
Supplies you need to have available would be a skin protector, a plastic bag, washcloth and towels, a wafer, stoma adhesive paste, a new pouch, a clamp, and a measuring device if needed to empty the bag. You would also want to have a pencil, a measuring guide, and a scissors available if you had a wafer you needed to cut to size. Some tips to follow when you're changing a colostomy bag would be have the patient lay on his or her back, drape an old towel under the colostomy, don't use scented soaps, report any unusual color, size, shape, or bleeding, and have all your equipment out and ready to use. During this whole process, you'd want to make sure to explain everything you're doing to the patient so you can use it as a teachable moment. The first thing we're going to do is apply a colostomy bag. And there you will see a healthy stoma, the pink to red, moist, warm, with no pain. First thing we would do is provide privacy. Wash hands, set out all your equipment and have it within reach. You'd want to raise the bed, now you'd want to put on your gloves. Now you want to place the towel below the stoma. And if there was a bag on there already, now is when you'd want to empty it. So now you want to cleanse the skin and the stoma with warm water with no scented soap. And you want to pat the skin dry. If you had a wafer that you needed to measure to size, you'd want to leave 1/8 to 1/16 of an inch between the wafer and the stoma. Now you'd want to apply a skin barrier, protector to the skin. Just put that on the skin around the stoma. And now you want to open up your wafer. And remove the backing of the center. Now you can change your gloves. because they will be sticky. Now you want to center the stoma in the middle of the wafer. And press down to firmly get the seal. And then you can press it down, and then you can remove the paper backing from the outside of the wafer and smooth out any wrinkles. Then you can press down for 1 minute to get a good seal. Once you have a good seal, you can put the clamp on the bag. Then you can snap the bag onto the wafer. Alright, now you can remove the towel, remove your gloves. You can get the patient in a comfortable position and cover them up, lower the bed. And now you can, if you need to put gloves on to remove, otherwise you can remove all your discard. Now you'd wash your hands and you're done. So now we're going to go right back into the room and we're going to empty the colostomy bag. So you would come in, provide privacy, you would wash your hands, get the patient in a comfortable position, and now you would make sure all your equipment is set out, and for emptying we would just need a measuring device and a towel. So now we would grab a towel. Okay, now we can put on our gloves. Go to the appliance. And we will open up the clamp and fold the end of the pouch up like a cuff. Make sure to have a towel underneath in case any comes out of the bag. And then we would empty the contents into a measuring device. Okay, and now we would wipe the bottom 2 inches of the bag just to clean that off. And then you will uncuff the bag and put the clamp back on. Alright, and then we'd get rid of the towel, take our gloves off, and cover the patient back up and lower the bed. Then you would put on a pair of clean gloves to discard the stool in the measuring cup. And you discard the stool in the toilet and remove your gloves and wash your hands. And that concludes our teaching video.